And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So do you think kids, if they don't listen to their parents, they're going to listen to a doctor?
I mean, I don't see kids, but I see adults, and adults sometimes like kids. But I mean, I think it's a difficult habit to break. I think they're listening and they know it's bad, but it's such a habit to break. We know that the substances are addictive, and so that's just a whole entire issue. It's good that we're recognizing that the kids are smoking and that we're trying to start at them early, because it takes about 9 or 10 attempts to stop smoking.
Wow. Is it one of the hardest addictions to stop?
Well, I don't know about that, but I know it's pretty hard. It's up there, top 10 probably. So that's why we try to encourage them not to even start. In my experience, beyond the age of 30, it gets pretty impossible to stop. There's a lot of products over the counter that you can try, as well as prescription medication. We just recommend you keep trying as much as possible. Even if you can't completely quit, cutting back is also a good option. It's just such a negative impact on your health. I just can't describe it to you. Smokers, in my opinion, just do so much worse, have so many more medical problems. So it's just a terrible habit. We just recommend patients try to do what they can to cut back on smoking or never start.
All right, on to some of our viewers' medical questions. This person says, I have fibromyalgia and I've been taking medicine. Does the pain ever stop?
I think for most patients it can, but it is a multifaceted approach to fibromyalgia. Typically, we recommend they exercise, eat a healthy diet, certainly get good sleep, and certainly try to manage anxiety, depression, which typically does involve fibromyalgia. So normally it's just not one thing, it's several things to get them managed.
Okay, another question. My heart beats fast. A doctor gave me medicine for the problem, and then he cut me off. Now I'm getting panic attacks, and I told him that, and he won't give me more medicine. I feel bad all the time. What can I do to feel better?
I would just have to assume that the palpitations or the fast heart rate may be a sign of anxiety, and maybe the doctor was giving him medications for anxiety, but now feels uncomfortable prescribing that, just so that the viewers understand the sedatives out there, Xanax and the benzodiazepines, are high-risk medication, and some doctors just don't feel comfortable. There are other anti-anxiety medications which help, so maybe I would just seek care from another physician, maybe try to get a prescription for those medications, such as Effexor or Wellbutrin.
Is there anything over the counter that one can take for anxiety?
Not that I know of. Certainly the medicinal herb products may be tried, but I don't know anything about those, to be honest with you.
Okay, another question. What else besides sinuses can cause my ears to be clogged up, and how do I get rid of the problem?
Probably wax. It happens often, and we have some things we can do in the office to unclog the wax. There's over-the-counter products as well to reduce the load of wax. It doesn't have to be wax-free, so sticking the Q-tip in the ear is not a good idea.
Does that just clog your ear more?
That's right, absolutely. It traumatizes the skin. It can bleed. So just go to your doctor. They can clean it out.
Okay. This person has MS, and her kids are showing signs of MS. They say that MS is not hereditary. Should she get them tested?
I think that they're showing signs. Absolutely. Always go in and check with your doctor. MS can be very difficult to diagnose, especially in the early stages. Normally you need a brain scan and sometimes a lumbar puncture to analyze the fluid around the brain. But certainly if you feel like they have symptoms, get them in for evaluation.
Okay. Can the medication Lyrica and epidural steroid injections for back pain have side effects that mimic having a stroke?
I think Lyrica can, because certainly it's augmenting the hormones in the brain, and that's how the brain operates. And so anytime you start ping-ponging those hormones around, anything is possible. So absolutely. The good thing is it's reversible, so stop the medication, get with your doctor. But if you think you're having a stroke, get to the emergency department.
All right. And we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person wants to know, what is scalp psoriasis and what can be done about it, and does the hair grow back?
Well, psoriasis is a common problem, kind of a chronic idiopathic inflammatory condition. Can cause large, scaly, red plaques, looks like fish scale basically.
Ugh.
Can appear on a lot of areas of the body, the scalp in this particular case. If you don't treat it, I think it can destroy the hair follicle, and thus you can become bald or the hair doesn't grow back. The good thing is there's good medication, topical and systemic. The dermatologists normally handle this particular disease because it can become systemic, and there are a lot of good medications on the market.
Can you get anything over the counter? Can you use like Head and Shoulders or anything like that? Because it kind of looks like dandruff as well.
It does. I mean, it's just too potent of a inflammatory condition. Over-the-counter products typically do not work, and time is of the essence, so you need to get something fairly quickly if you want to preserve those hair follicles.
Okay. A woman takes 3 milligram steroids as prescribed. She's put on a lot of weight. How can she lose that weight?
Yeah, those steroids are terrible.
Yes.
You know, I mentioned last week, I use a lot of them in the office. I just love steroids, but yeah, there's a side effect to that. Weight gain is one of them. As soon as they stop the medicines, the weight should go away. It may take several months, but it should go away once they stop the medication.
Does she just need to buy bigger sizes until then?
Well, absolutely. You know, it causes increased appetite, increases weight gain. It is a metabolic problem with the steroids that causes the weight gain, but it should go away. They just have to get off the medicine.
A 63-year-old has an achy neck, not from sleeping. It's only on the left side. Had an aneurysm 9 years ago. Could it be related?
That's always a concern, and I think because the situation is so dire, if we miss it, we typically will look for it just so that everyone can sleep better at night, but probably not related to the aneurysm. Probably cervical arthritis, we talk about that a lot, and inflammatory medicines can be tried, massage, injections.
Okay. What can cause the tailbone to ache?
A lot of times patients who are not very heavy and they sit a lot can certainly cause irritation to the tailbone. Arthritis can cause that. So we normally start off with anti-inflammatory medications or topical medicines such as Lidoderm, which is just a patch that has lidocaine in it. It works very well.
Or you can just sit on a pillow.
Absolutely. Or get up and move around, run around.
What does it mean if you can't donate plasma because your beta is too high?
I'm assuming that, you know, they're doing a lot of screening with the blood products these days to make sure it's absolutely safe. I think any type of abnormality, then they don't allow the patient to donate the blood, and normally recommend they get with their primary care doctor or hematologist, kind of do a full workup, make sure everything is okay, and probably can go back and give blood if nothing was found.
Okay, another question. Since I was a child, my muscles have pained me. It often happens when I get cold. What could it be from?
Sometimes, not really sure, to be honest with you. You know, we're all built differently. I think just a good basic evaluation, some good basic blood work, just to make sure everything is okay, is what I would recommend. But certainly if it remains that way, probably wouldn't get too excited.
Okay. What are some ways to lower your blood sugar?
Actually, stay away from the Cokes and pies and biscuits and gravy that we all love. French fries, chips.
French fries. Oh,
yes.
That sounds really good about now.
Try to do the vegetables and the fruit, fresh fruit, that is, whole grains, nuts, beans, so basic stuff.
All right. Thanks, Dr. Levine. We
Absolutely.
appreciate you stopping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com, or you can post those questions every Monday on our KFTM News Facebook page.